Hi, it's Dr. Clark. Talking to you today about the nervous system, the part of the nerves that control the knee. There are three main nerves that are involved in the knee. So as far as feeling goes, up above the knee you have the L2, then right above the knee you have the L3, and the knee is mainly controlled by the L4 nerve root. That means it's coming out between the fourth and fifth lumbar vertebrae of the lower back. And then down below, you'll have the L5, okay? But this L5, L4, and L3 are the most common ones that affect the knee. Now, in addition to the feeling of the knee being controlled by different nerves, also, of course, the muscles of the knees are going to be controlled by different nerves. But primarily, the femoral nerve, the obturator nerve, are going to control most of the nerves, most of the muscles around the knee. And you're going to, again, most of those are going to be L3 and L4 nerve roots. So the bottom line is, if you have a problem in your back that's affecting these nerve roots, any of these nerve roots here, your knee is not going to be able to recover. So how do we fix that? Well, number one, we must look at the lumbar spine to make sure there's not something interfering with the nerves. If so, we'll use chiropractic adjustments, maybe spinal decompression, and some physical rehabilitation to begin to get the pressure off the nerves. We also must make sure that these nerves are able to, again, innervate those muscles, and that's where we use the physical techniques we talked about last time, trigenics therapy, and also rapid release therapy. And then lastly, we must then begin to create a new neurologic habit. And we also must make, by the way, sure that the brain is actually able to activate these muscles. Sometimes a person has a knee pain because really they can't work any of the muscles in their whole leg properly. And if that's the case, it's going to be the frontal and parietal lobes over on the opposite side of the brain that are going to be controlling that. That's why even on our knee patients, we also still do a functional neurologic exam where we have you do some finger to nose, some eye movements, some other tests to make sure that the brain is not part of the problem. And if it is, it can be rehabilitated in most cases. So, by taking a big picture and looking at everything, as far as physically, we look at the back, we look at the bones, we look at the ligaments, we look at the muscles, and then we look at the nerves, we can have the best chance to recover from your knee condition. And not everybody's going to have problems with every one of these. Maybe your case only has problems with maybe 2 of these, maybe 3 of these. But every case is different. Every case must be treated appropriately for what the problem is. And there's one other thing I'm going to talk to you about on the next video, and that's about how nutrition plays a role in your recovery. So have a great day. I'll talk to you again soon. God bless.